A very good day to everyone. Today we explore whether sound is the medicine of the future. I'm Conny Lerch. I'm a consultant anaesthetist at the Royal Orthopaedic Hospital in Birmingham, United Kingdom. And we do major cancer and scoliosis surgery. Today, however, I represent the Sound Healing Academy and Tony Neck is our principal. We'll touch on a little bit of history. Sound is energy medicine. What is it? It's all about the vagal nerve and keeping our natural biofeedback mechanisms intact for good health. And how can we bring music or healing sounds into our lives? In ancient times, there were major healing centers using music. And you, of all nations in India, will be very familiar with the collection of over 1,000 Sanskrit hymns composed 1,500 years BCE. And even that's been preceded by prehistoric music, and flutes were found in Europe that are 40,000 years old. So it's not really a new age modality. And we're not going to stop making music anytime soon. Edgar Cayce, he was the so-called sleeping prophet. About 100 years ago, he predicted sound is the medicine of the future. It's not quite here yet. However, futurists have been correct in predicting the future. One of the modern futurists is or was Steve Jobs. And perhaps Elon Musk is the latest who predicts that we will be able to upload consciousness to the clouds. And I know many, many millennials who believe that. So, but let's stay in the present. There has been a huge revival of all kinds of complementary and alternative modes of medicine in the past. And the reason for that is quite obvious because, and in your conference title, it says so eloquently, the millennial anesthesiologist, a versatile savior. We do need new solutions to create a sustainable and affordable health system. Because at the moment, the baby boomer generation is reaching retirement age. They're now called the gray tsunami, and many of whom suffer from the first world medical problems. 80% are stress and lifestyle related, and hypertension, obesity, diabetes, to name a few. 50% of our entire health budget is spent in the last 6 months of people's lives. So we are looking for solutions, and the lifestyle of, it turns out that the lifestyle of the present moment in the third millennium is to harness the power of now. It means it is at the center of all alternative well-being trends, yoga, Pilates, meditation, mindfulness, that with simple, natural methods, breathing healthily, relaxing, singing and dancing, hugging trees, very affordable, non-invasive methods, we can keep our physiological health and harness our self-regulating and self-healing powers. So it's the responsibility of every individual to stay healthy. And the emphasis really is on prehabilitation, prophylaxis, and prevention. And hopefully we are able to evolve the currently science-based medicine into a more holistic medicine. And the reason is we are a little bit stuck in a 400-year-old paradigm from the 16th century, where it made total sense to separate science from everything that was metaphysical. And as a result, we view still today the world mechanistic. And our modern medicine at the moment, very much, we're still thinking we can fix people like machines. However, for over 100 years now, it is quite clear that the modern scientific model of reality is based on quantum gravity, which tries to reconcile quantum mechanics and general relativity, meaning reconciling the micro and the macrocosm. What it means is that on the microscopic level, everything is quantized energy, and there are 12 subatomic particles, and they are held together by 4 fundamental forces, creating energy fields, perhaps even on 12 dimensions. So this view means that the human body is, at the same time as it is physical, also an energy body. And what is interesting is that the energy precedes the physical. So if the energy is in imbalance, the idea is that the physical manifestation also is out of balance. The best known subatomic particles are the photons. They are the smallest energy units of light and electromagnetic waves. And then the phonons, they are the smallest vibrating particles of sound fields. And these energy fields form our subtle bioenergy field. And so modern physics provides the framework for energy medicine. And all it means that, for example, with sound, which is an energy sound field, we treat and harmonize the bioenergy field of the human body, and therefore hopefully keep a healthy balance in the physical body. And it's been passed on from millennia that people are feeling their energy, and it's quite possible. It's called the life energy, chi, the aura, the kundalini. The chakras are 7 main energy points in the body, and increasingly we can measure these. For example, the most commonly known system is the chakra system. There are 7 main energy points in the body, and they all have very important systems of nerve plexi and organs as counterparts, which means that, for example, the heart chakra and the crown chakra, they are in the right place where we have the very highly electrically active organs, the heart and the brain. And of course, they create an electromagnetic field, and we can, in fact, measure it. And whilst the tradition talks about energy centers, the modern physics model is quite similar. It talks about a torus. The torus means that everything that is physical, be it a cell, an organ, a human body, an apple, a tree, or the universe, is an energy hologram looking like this torus, and in the vortex, the physical entity is recreated every nanosecond over and over again. And the idea being to keep the whole system healthy and in balance. As anaesthetists, we do a great job. We enable surgery, and that helps many of our patients. The treatment is mostly mechanistic. However, doctors, surgeons, anaesthetists, there's much evidence that also we are mortal, and we are not doing all our patients a great favor. I would say in my own demography, there are perhaps 70% of people where we treat purely symptomatic, where we treat too much too late, when early, non-invasive, simple and more pleasurable interventions might avoid such extreme conditions. Doctors are notorious for unhealthy lifestyles. There's a high rate of drug abuse and suicide. So do we need to throw more resources at research? And there is, in fact, a lot of research out there already telling us that music therapy is helpful in many conditions. What we need is perhaps rather a consciousness and paradigm shift. and it's mostly individual experience that brings people to alternative methods. I had symptoms of burnout about 10 years ago, feeling fatigued and not as happy as I wanted to be. So I turned to complementary medicine. It was very effective, very quickly, and sound therapy being the most profoundly helpful. I wanted to continue to surround myself with sounds, so I took a diploma. And I want to say here that I am no musician. I have no musical education. I'm a beginner. If I can do it, anyone can. As doctors, we are healers. We have to be fit and healthy ourselves if we want to help others. And so you can start, as I did, on a very basic level. You only need about a few instruments, starting with perhaps 3 tuning forks, each of which has a particular frequency to provide a certain musical intervals. A medium-sized Tibetan singing bowl, and a simple percussion instrument, a drum or a shaker of sorts. And I can't stress how I found it was a revelation to discover my own voice as a healing instrument. Just sounding to myself is very soothing to my physiology. And whether you're a beginner or whether you are a music expert, there's enough music theory behind it all to keep you interested. Now, you can throw any instrument in that pleases you. There is a system behind the teaching, the most important being integral sound healing, which means that we are not just treating the physical body, but everything that's metaphysical as well, which is the emotions, intuition, the atmosphere and thoughts, visions. Now we tap into our creativity and we learn to listen to silences, listen to our body, feeling into the very subtle level of our sensations and learning to feel when our physiology or our energy is off balance. There are 2 ways bringing sounds to the client. One is on the body, one is off the body. That off the body means we create sounds and then they are played in the proximity of the client and they interact with the sound bioenergy field of the client. And on the body with small instruments, usually in a one-to-one session, you can use either small Tibetan bowls or a tuning fork with weights. You activate it and you can place it on anywhere really on the body, the sternum, the sacrum, anywhere where you have tendon aches. And these two methods. Every healing session follows a 10-step process for the best healing effect. I will show you now examples of what kind of sounds we are creating.
Biofeedback tools help us to monitor the state of our natural biofeedback mechanisms. Since the 90s, there is some good science-based biofeedback technology around that has evolved. Many of you will have apps that tell you how well you sleep and how fit you are. Established are the HeartMath Institute and Autonomous Nervous System Analysis. They both have their own research department, and they show that simple interventions like mindfulness and healthy breathing, loving kindness will reduce stress-related diseases and establish eustress. We all have fallen off the stress curve, either into the extreme fight-flight or into the shut-down freeze mode. However, healthy stress makes evolutionary sense. We are all born to deal with extreme challenges from our environment with an appropriate, highly effective sympathetic fight-flight response. However, that is meant to be short-lived, only temporary, and then it has to be followed for good health by a highly recreational rest recovery phase that is prolonged, a phase where we thrive as individuals, we integrate everything we have learned, we feel rewarded with physiological pleasure because we have a sense of achievement, and we feel happy and healthy. A good parameter to measure is the heart rate variability. It tells us the state of our autonomous nervous system and how balanced it is. It measures the moment-to-moment variation of the heart rate in each breath cycle. Should be around 15%. It starts to decline from our 20s onwards. And if it has a particular low threshold, something less than 20% of 100%, then apparently the mortality within 6 months is near 100%. Certainly, I did not learn about the Polyvagal Theory in my med school. It has been introduced in the 90s by Stephen Porges, and he postulates that there are 3 branches of the, or 3 circuits of the autonomous nervous system, and they all have evolved in a hierarchy in our evolution, depending on our response to the environment at the time. The most primitive is the earliest
infradiaphragmatic vagus nerve, and with the freeze and shutdown response. Slightly later came the sympathetic nervous system, and finally, in the mammalian era, the social engagement vagus nerve. And this one really mediates and harmonizes the two more primitive branches. It is interesting that the upper part of the vagus nerve, the social engagement branch, is responsible for the innervation of all the organs that have to do with communication, facial expression, listening, speech. So this is we can measure the heart rate variability with such a monitor. We put a heart monitor around the chest, and here's an example of a good regulation. 3 bars all in the green zone. The purple is the heart rate, the red reflects the sympathetic nervous system, the blue the parasympathetic. Here an example of sympathetic dominance, and which means the red bar is high in the red alert zone and the blue bar is low in the red alert zone. This is the opposite. It's induced by beta blockers, and also it shows parasympathetic dominance and is not a healthy state of physiology. Of course, we don't need a machine to tell us. We have simple observations of our own body, and I'll show you a couple now. So if you, wherever you are, sit very relaxed and close your eyes gently. And observe where in your mouth your tongue sits. Is it at the floor of the mouth, or is it touching the soft palate? And now if you observe the flow of air into your body, when you breathe in for a few breaths, and also observe whether your abdomen moves outward or inward on the in-breath. And you can open your eyes. If you find your tongue is resting against the soft palate, if your breathing stops somewhere above the diaphragm in the middle of the lung, if your abdomen draws inwards rather than relaxes outwards, you're in a slightly more sympathetic tone at that moment. If you do a malampati, you can see whether the uvula deviates, and that would be a sign of an imbalance. There are many other symptoms many of us all too often ignore, of either sympathetic or parasympathetic dominance. However, if you give yourself a vagal break, it means activating this social engagement upper ventral branch of this of the autonomous nervous system, then we can interrupt the dominance of either the sympathetic and the parasympathetic nervous system. Before we use any particular treatment, again, there are simple techniques we can do anywhere in our day-to-day work and day-to-day life. Even being in nature gives us a wonderful vagal break. We can do breathing exercises which last a few minutes, where the exhalation is slightly longer or deliberately longer than the inhalation. In general, doing abdominal breathing is very relaxing, so all the muscles relax on inhalation. And the parasympathetic nervous system kicks only in after about 30 seconds of total relaxation, which means your mind is still, your muscles are totally inactive, and your body is almost breathing without effort. Another nice technique I put my thumbs gently on the inner side of my bony orbit and press a little bit. And that totally relaxes my facial muscles. Another exercise is what Tony shows here. You interlock your fingers behind your head and you gaze to one side. You turn your head to one side and gaze without straining yourself. And you stay there breathing for 1 minute. And then you repeat it on the other side for equal measure. If we miss the boat and we get into some imbalance, then there are other methods. Modern medicine has a vagus nerve stimulator that can be implanted. But of course, sound healing is a much more cheap, non-invasive method. And using certain frequencies, typically with the Otto 128 Hertz weighted tuning fork, it's known to stimulate the nervous system. And what you do with it, you activate it, you place it on your sternocleidoid muscle on the upper part. You wait until the vibrations subside and repeat it 3 to 5 times. And then you repeat it on the other side. Another good frequency is the Om, apparently at 136.1 Hertz for people who like numbers. Hans Kuster was a music scientist in the last century, and he calculated from the periodic orbits of the planets around the sun and so on, certain frequencies and the planetary tone system. So each planet got a particular tone, and the Om is thought to be the 136.1, the frequency of the Earth. You don't need to use that frequency in order to chant Om. Even chanting Om is a soothing syllable. And by chanting, you always have automatically a longer exhalation, which in itself gives you a vagal break. Using certain frequencies together can create a relaxing alpha brain state. Before a sound healing therapy is given, there's always an assessment, obviously, of the condition that you're trying to treat. And for example, you would assess whether there is sympathetic or parasympathetic dominance. And if it's sympathetic dominance, the treatment is slightly different. Tony, you would use very harmonizing musical intervals. In the 12-tone system, that would be the 4th, 5th, and 6th. And using nurturing sounds with particular instruments, all that relaxes the sympathetic nervous system. Certain tempos and rhythms with percussion and drums give you relaxing brainwave states. Here you can see how Tony has placed 2 singing bowls, one on the sternum, very close to the heart and the heart energy field and the heart chakra. The second one can be placed on the solar plexus, on the sacral chakra, you know, wherever there are the organs that maybe people complain about. As I said, depending on which instruments you use, most instruments have full octaves. And this is an example of crystal singing bowls this is 1 octave. You can have the half tones in between as well. And in the Indian raga musical theory system, you get up to instruments with up to 66 microtones. Should you have a patient or with parasympathetic dominance, then there are different techniques. You want to really engage the client much more and provoke the life energy a little and bring it out. You can do that by helping the client to contribute and making music, singing, dancing themselves, chanting. You would use other intervals, more dissonant intervals, that is the 2nd, 3rd, and 7th. And these release energies from the body that can cause blockages and help in this situation. The breathing pattern that helps for these clients is to breathe gently and slow in, and more forceful and with a shorter period out. So in a workshop situation, Tony measured the autonomous nervous system with a perfectly healthy participant, male, and interestingly, despite having no idea being perfectly healthy, he did have a slightly lower parasympathetic nervous system bar. And so it is interesting because this gentleman is fit and well. He is in a very relaxing environment and following the hobby of his choosing. However, if you imagine as anesthetists, sometimes we are in such stressful situations, and it's quite likely that we are all day long stuck in the sympathetic dominance, which makes it chronic. This gentleman then underwent a short 20-minute sound healing intervention. And here I give you a short example of what that would look like. A one-to-one treatment where the client lies on the couch and Tony is actually placing certain singing bowls with certain frequencies under the couch. So the sound that he creates will go through the couch and be felt from the back through the body and totally surround the body. And it's also interesting to see how he uses his voice to tune into the sounds he's creating. Here you see the measurements after a short sound healing session. The blue bar is now in the green zone, a slightly more balanced picture. I want to show you a short video, an example how a group chants Om to one person. This is a wonderful, soothing experience for the individual who's singing and chanting, as well as for the person you chant to. And anyone who sings kirtans or mantras or in a choir knows that.
So just to finish off, we did some toning for Martin, some group toning, chanting Om. And this is also designed to help him just boost his parasympathetic functioning a little bit more, just to finish it off. Everyone loved it.
I do want to mention the altered states of consciousness. After all, this is our daily bread and butter. And there are 5 categories of brainwaves, beta and gamma being when we are alert, awake, and solving problems, concentrating. Alpha is a relaxed, awake state. Theta and delta are sleep states. We are using the bispectral index BIS for depth of anesthesia in long scoliosis surgery with TIVA. We aim for anesthetic depth of 40 to 60. Anything above 60 might create some awareness, and 100 means the patient is fully awake. You can, interestingly, with a short meditation, reduce your BIS number to around 80, which is perhaps equivalent to a relaxed alpha state. There has been a huge revival of shamanism, and there are very modern millennial shamans all over the world, and they're using, 90% of shamans use drumming rather than drugs to create altered states of consciousness and healing states. The physical mechanism behind it is a sonic entrainment. 2 vibrating bodies in proximity start to resonate together. If you were to drum very monotonously for 15 minutes at a frequency of or with 210 to 270 beats per minute, that is a frequency of about 4 hertz, then you do induce these deeper, relaxing states of consciousness, including trance and hypnogenic states. However, these states are very healing and deeply relaxing to our physiology, and they inspire our creativity. There are, in fact, especially in Latin America, hospitals where there are contracts and shamans come into the hospital and doing their work, their sound healing work around the patients. The Sound Healing Academy offers courses for all levels and all tastes, from basic to advanced, and for individual instruments or any number of instruments. You can gain in about a 2-year course a certified diploma and become a professional practitioner. You can specialize in one-to-one sound healing or group healing. I did the group diploma, so it enables me to give sound baths for the public or hospitals, schools. There's a lot of online material, workshops, and there are students in 70 countries who take our courses. At this point, I hope I have inspired you perhaps to use one or the other method to look after your physiological balance and take a vagal break regularly every day, 2-3 times. And perhaps you may even start singing in the shower, perhaps chanting with your family at home or even with your team before the start of the day. You could maybe invite a shaman or sound healer into the hospital to benefit your patients or staff alike. So I wish you a wonderful and sunny rest of the day.